So in this module, we are going to look at vagal tone and what vagal tone really is. So here you can see a picture of the vagus nerve and where the vagus nerve comes from. So it actually comes from the brain all the way down, and then we'll go through all of the different organs that you have in your body, and then from there all the way back. So it has to do with the signal that comes from the brain down all the way to all of your organs, and then the signal that's coming from the organs all the way back to the brain. So your vagus nerve, also known as the 10th cranial nerve, is one of the most important nerves in the body. It is also the longest nerve in your autonomic nervous system that extends from your brainstem through your neck into your chest and your abdomen. It connects your brain to your gut, and it carries important sensory and motor information. Your vagus nerve supplies innervation to your major blood vessels like your heart, your lungs, your airways, stomach, your esophagus, and your intestines. And when it comes to the vagus nerve, one of its important functions is its role as your body's major parasympathetic nerve. Remember that this is your rest, restore, and digest system, and this is where the vagus nerve plays a huge role. It helps to slow down your heart rate, to regulate your blood pressure, control sweating, control the gag reflex, allowing the involuntary constriction and relaxation of the muscles of your gut, and control of vascular tone. So the vagal nerve is the first autonomic branch to develop in a fetal's life, but does not have significant function prior to birth. Next to develop is your sympathetic nervous system, or division of the autonomic nervous system, which shows ready development throughout the fetal period. The parasympathetic division does not exert much influence prior to 25 to 30 weeks. The prematurely born infant, this normal third trimester, it increases in the parasympathetic tone and it may be dampened. All right, so what this basically means is that, remember, the sympathetic nervous system, which actually takes the photos, I would say photos, but you understand what I'm trying to say. It will take the photos of all the different traumas and things that's happening in the environment, how it feels, the different cortisol levels, the hormone levels. It will take snapshots of that and it will store it in the nervous system. So this is very important to understand, that the sympathetic nervous system is first to develop. So if there's an overstimulation of trauma in the womb, this is very, very important to understand that the sympathetic nervous system has now already been switched on. So only after 25 to 30 weeks, the parasympathetic nervous system kicks in, which will try to regulate the sympathetic nervous system. So babies that are prenatally exposed to a lot of stress, like I've mentioned in the previous modules, are a lot more susceptible to stress later on in their life. The vagus nerve is involved in many areas across your body, making a good vagal tone very important. A good vagal tone is very important for the following: to lower your blood pressure, to lower heart rate, managing stress and anxiety, regulating your mood, decreasing inflammation or pain in the body, delivering information between the brain and the gut, and providing sensory information from the throat, the lungs, and the heart, regulating swallowing, and also regulating speech. So let's look at poor vagal tone. Experiencing other forms of trauma, including serious car accidents, serious illness, losing a parent or a loved one, deep poverty or war, also negative affects the vagus nerve. and may lead to a chronic fight and flight or a shutdown danger state. So while our early childhood years are the most critical for healthy development, traumatic experiences later in childhood, during your teenage years or your adult years can affect your vagus tone, your vagal tone as well. Post-traumatic stress disorder, which is accompanied by a poor vagal tone, often develops due to traumatic experiences later in life. For example, if they experience war, physical or sexual assault or abuse, domestic abuse, car accidents, losing a loved one, or serious illness. Even if your vagus nerve isn't damaged, you may experience poor vagal tone. So let's look at the symptoms of poor vagus tone or vagal tone. So it may be anxiety, depression, poor emotional regulation, high levels of stress constantly, being in the fight and flight mode all the time, lowered attention span, increased inflammation in the body, and also pain. Chronic systematic infections, including infections from Epstein-Barr virus, the Borrelia bacterium responsible for Lyme disease, enteroviruses, chickenpox, and HIV, play an important role in your brain and nervous system and your health. So, for example, if this vagus nerve doesn't work properly as it should, you are more susceptible for these chronic infections. These infections may appear around the vagus nerve and may be responsible for chronic fatigue syndrome, mental health, or neurodegenerative issues. And these symptoms, infections, can compromise your brain health, trigger inflammation and pain, and a variety of other symptoms and chronic disease. So chronic infection may increase your risk for anxiety, depression, fatigue, brain fog, memory issues, cognitive issues, and other mental health or neurological problems. So I looked at Dr. Joker's PowerPoint with regards to the vagal tone, and I thought that I would just include it in this teaching as well. It also just helps you to understand it better. So let's quickly see. The vagus means wandering in Latin, which describes how the vagus nerve travels from the brainstem down as far as your digestive system. The vagus nerve plays an important role in almost every organ system of the body. If you have a healthy vagal tone, you will be able to regulate your bodily functions very well. So let's see, there must be a healthy pulse rate and blood pressure, a healthy blood sugar and body weight, normal speech and swallowing ability, good digestion and bowel movements, calm and a peaceful mind and a positive mind. Major causes of poor vagal tone are the following: chronic stress and poor sleep, early childhood trauma experiences, head injuries, poor breathing mechanisms, chronic infections, blood sugar imbalances, and high toxic load. And remember that this high toxic load comes from what we eat in our environment, but it also comes from parasites, fungus, and bacteria that is present in the body. So the influences of the vagal nerve, let's look at them. Inflammation, it suppresses inflammation via the cholinergic anti-inflammatory pathway. Heart, it decreases your heart rate and your vascular tone with your gut. It increases gastric juices, gut mobility, and stomach acidity. With your liver, it regulates insulin secretion and glucose homeostasis in the liver. With your mouth, taste information is sent via 3 cranial nerves, one of which is the vagus nerve. The vagus nerve is needed for the gag reflex, swallowing, and coughing. Blood vessels. It decreases your vascular tone, lowering blood pressure, and with your brain, it helps to keep anxiety and depression at bay, opposes the sympathetic response to stress. So there are different exercises that you can also go and read up on to stimulate proper use of the vagal nerve. And with regards to the information that's been given now, you can also have an idea if your clients or if you yourself or family members are struggling from poor vagal tone. And remember, at the end of the day, it all has to do with trauma and inherited trauma and what the body has been exposed to.